The main difference that I'm having with the LAO is with respect to what constitutes managed care rates under Medi-Cal or healthy families. The LAO says this could cost over $1.5 billion. Well, that assumes that the managed care rates are going to be well over 50% of what we're paying today. And I think that's a false assumption. And nobody can question that we have an independent funding stream that will not impact the budget to make sure that this progressive, incredible, historic healthcare reform plan gets the proper review and hopefully the support of the California State Senate, and that they follow the lead of the Assembly on this plan. We feel very strongly that our plan is strong, it makes sense, it's fully paid for, and I think the LAO acknowledges that. I think some of these worst case scenarios that were developed in our office are strictly based upon the most negative view of the future. And anybody who looks into the future, you know, through the telescope of negativity will never get anything done. Those of us who want to change the status quo, that say that we're sick and tired of this current healthcare system that is abusive, that takes advantage of people, and that leaves many people uninsured, that we need to change the status quo. And I'm hopeful that my colleagues in this Senate Health Committee are going to agree that it's time to change the healthcare system. You ask Californians what they think, and overwhelmingly, Californians say, fix the broken healthcare system that we have in California. 6.5 million people don't have health insurance. If I can figure out a way to get 70% of them to have health insurance, it's better than the status quo. So, you know, people can talk all day about, you know, all the problems that we have in this bill. But at the end of the day, the status quo is much worse than what we're proposing, because what we're proposing is fundamental reform to our healthcare system. Now, I got to admit, we don't regulate the health insurance industry in the way that I would have wanted to. But what we do is require them to spend 85 cents out of every dollar they take in on patient care, so that it changes the focus of their business model. They're not in the business of healthcare to pocket the profits. They're in the business of healthcare to spend 85 cents out of every dollar on the care of their patients.